Smile greetings. I am Teja Lopal and you are watching my channel Learn Sujok for free. Friends, this is the fourth course with 6 videos to learn the Sujok steps that should be followed to self-treat a chronic disease. If you really wish to gain from this course, you must watch my videos in the order that they are given chronologically and also watch each video till the end. If you like my videos, then subscribe to my channel and press the bell icon next to it.
All right, now we are into the step 4 of the 5-step treatment, which is the treatment of corresponding segments of spine. The 4th step involves the stimulation of the point that corresponds to the segments of the spinal cord and the roots of the spinal nerves, which are the elements of the sympathetic and parasympathetic nerve system, which are involved in the area of illness or the affected organs. Now, first, let's understand about the spinal cord. Fibers called nerves carry important messages back and forth between your body and your brain. That network, which is called your nervous system, has 2 parts, your brain and the spinal cord. These make up your central nervous system, and the nerves in the rest of your body, they make up your peripheral nervous system. Everything your body does is connected in some way to your nervous system. It tells your heart to beat. It tells your lungs to breathe. It controls the way you move, the words you say, and how you think and learn, everything. It also controls your senses and memories. The spinal cord transmits information from every corner of the body to the brain and delivers the commands from the brain to every part of the body. Now, how does it do that? You remember we call the spinal cord the triple warmer for this reason only, because it literally connects all 3 parts of our body, the head, the chest, and the abdomen. If there is even a little bit of blockage in this transmission to and fro, then this can have a very profound effect on you. The spine is the most important part of your body, and it would be impossible to stay upright without it. The spine gives structure, support, and flexibility to your body. Not only that, most importantly, the spine also protects the spinal cord. The spine is made up of a column of bones called the vertebrae, which are, bones which form the spinal column. The spinal cord is the long cylindrical structure that connects your brain and the lower back. It contains tissues, fluids, and nerve cells. The spinal cord helps carry electrical nerve signals throughout your body, allowing us to control our movements. The brain mainly coordinates the voluntary functions of the body through the spinal cord. On the other hand, the spinal cord contains many reflex arcs which control the involuntary functions of the body. In this 4th step of the 5-step treatment, you should give special attention to the spine in chronic cases by treating the painful points on the spine. This is a very important step in the treatment and should never be ignored. Even if the spine is good and there is no pain in it, still you should definitely find and stimulate the spinal cord. Now, the whole thing is, you should, what has to be done is you just locate the painful points corresponding to the relevant segment of the spinal cord and stimulate them. Search for the points to be stimulated in the projection of the spinal cord and in the areas where the nerve roots exist, related to the affected organs and parts of the body which you want to treat. In the spine, there are 33 vertebrae, right? 7 in the neck, which are the cervical, 12 in the upper back region, which are the thoracic, 5 in the waist region, which are called the lumbar vertebrae, 5 in the pelvic region, which is the sacrum, and 4 in the hip region, which is the coccyx or the tailbone. Sometimes a problem like migraine is caused due to some problem in the spinal cord. Now, which part of the spinal cord is the cause of this migraine is what we have to identify and then stimulate. Actually, honestly speaking, we don't really have to do a lot of work in this because Professor Park Jae-woo has already done all this study and made a table for us exactly which part of the spine has to be treated for which problem in your body. Let us see in detail which vertebrae has to be stimulated for which disease. First, let us actually go through, the spine, how it is placed in the main correspondence system and the finger correspondence system. When you see in the main correspondence system, Okay. In this picture, if you see, this is the main correspondence system. Then just to revise, the cervical vertebrae are on the thumb, in the back of the thumb, and then from below that till the bone, in just above the wrist, are the T1 to T8 thoracic vertebrae, and T9 to T12 are in from the wrist to about middle of the palm in the back side. These are all in the yang side, right? These are the T9 to T12 thoracic vertebrae. Then the lumbar vertebrae, five lumbar vertebrae. Then come the sacrum, and just between the middle finger and the ring finger comes the coccyx. So this is the positioning of the spine in the main correspondence system. Then this is the placement of the spine in the foot. Again, you can go through all the the thoracic vertebrae, and the thumb, on the thumb the cervical is there, and then the T9 to T12 thoracic vertebrae on the top of the foot, and the lumbar, the sacrum, and the coccyx between the middle toe and the ring toe. Then in the finger correspondence system also, we have already studied that on the cervical vertebrae are absolutely in the center of the top joint of the finger, of every finger, and then T1 to T9 are in the back of the first phalange. T9 to T12 is till the half of the second phalange, and then come the lumbar five vertebrae, then the sacrum, and the coccyx is on the absolutely in the bottom of the finger if you take the bone correspondence. So it just comes absolutely in the bottom of the finger. Now let me start explaining to you exactly which part of the spine has to be treated for the related diseases. Now C1, the cervical one, okay, vertebrae has to be treated when there is a problem with the blood supply to the head, when there is a problem in the pituitary gland or the scalp or the bones of the face, the brain, inner and middle ear issues, nervous system issues, and the symptoms that you could face related to these areas and parts of the body could be numerous. Some of them being headaches, nervousness, insomnia, colds, high blood pressure, migraine, nervous breakdown, amnesia, dizziness. If any of these symptoms are there and it is a chronic disease, then the fourth step would be to treat the C1 vertebrae along with all the other treatment that you're doing. C2 has to be treated when there is a problem with your eyes or the optic nerves, auditory nerves, sinuses, tongue, forehead, the possible symptoms being sinus trouble or allergies, pain around the eyes, earache, fainting spells, certain cases of blindness, crossed eye, deafness. In fact, actually, let me just tell you one thing before I continue with this. One thing that has to be noted is that you have to basically treat that vertebrae which corresponds to the problem area in the back. Okay, whichever problem is there in the front of the body, you just go to the related, directly behind it, which vertebrae falls generally. So that is something I'll explain to you later. Now, C3 has to be treated when there is a problem in your cheeks or your outer ear or face bones or teeth. Possible symptoms being maybe if you have a neuralgia or acne or pimples on your cheeks or eczema on the skin, some such issue. C4, if there is a problem with your nose, lips or mouth, and the possible symptoms could be a number of them like hay fever, runny nose, hearing loss, cracking lips, or any such thing that you might face. C5 is for vocal cords, neck glands, pharynx, symptoms being laryngitis or hoarseness, throat conditions such as sore throat, etc. C6 is to be treated for neck muscles, shoulders, tonsils, possible symptoms being stiff neck, pain in the upper arm, tonsillitis, chronic cough, or croup. C7 is treated for the thyroid gland or elbows, and possible symptoms being bursitis or colds or thyroid conditions like hypothyroid or hypothyroid conditions. Then we go to the thoracic vertebrae, the T1 thoracic vertebrae. You have to treat when you have an issue with a problem with arms from the elbows down, or including hands, even your hands, wrists, fingers, esophagus, trachea, etc. Possible symptoms being asthma, cough, difficult breathing, shortness of breath, pain in lower arms and hands. T2 has to be treated for heart, including its valves and covering, and coronary arteries. And the possible symptoms being functional heart conditions or certain chest conditions. T3 has to be treated for problems with lungs, bronchial tubes, pleura, chest, breast issues, possible symptoms being bronchitis, pneumonia, congestion, influenza, lactation problems, etc. T4, you have to treat for gallbladder, common duct problems, and symptoms being like gallbladder conditions, jaundice, shingles, herpes, etc. T5, you will treat for the liver, solar plexus, and general circulation, blood circulation in the body. And the possible symptoms would be liver conditions, any kind of liver problems, fevers, blood pressure problems, poor circulation in the body, arthritis, etc. Then T6, you have to treat for stomach issues, possible symptoms being any kind of stomach issue, including nervous stomach, indigestion, heartburn, all these hernias, ulcers, etc. T7 can be treated for pancreas and duodenum issues, possible symptoms being ulcers, gastritis. T8 is treated for the spleen issues, possible symptoms being ulcers, gastritis, lowered resistance in the body. When the immune system is compromised, you have to definitely treat the spleen. And with that, definitely treat T8, which is the thoracic 8 vertebrae. T9 vertebrae is for adrenal gland issues, and possible symptoms could be allergies, and even for emotional issues. Adrenal glands are very important to be treated for emotional issues. So that time also treat the T9 thoracic vertebrae. Then T10 is treated for all kinds of kidney problems, possible symptoms being like kidney troubles, hardening of the arteries also, because kidney troubles can result in those, chronic tiredness, nephritis, etc. Then T11 is treated for kidneys or ureters problem also, which is giving possible symptoms could be like skin conditions such as acne, pimples, eczema, boils. These also conditions occur when there is an issue with your urinary system or kidneys. Then T12 is the thoracic 12 vertebrae, which is treated for problems related to small intestines, lymph circulation, etc. And the possible symptoms could be rheumatism, pains, certain types of sterility. After the thoracic vertebrae are over, then comes the lumbar, 5 lumbar vertebrae. The L1 vertebrae has to be treated for problems with large intestines or inguinal rings. And the symptoms would be, constipation, colitis, dysentery, diarrhea, some ruptures or hernias which occur in, intestines. They could be inguinal, or they could even be hiatal hernias. Then L2, the lumbar 2 vertebrae are treated for appendix, abdomen, and upper leg problem. And the symptoms could be cramps or difficult breathing or varicose veins, being created. Then L3, the lumbar 3 is treated for sex organs problems or uterus or urinary bladder problems or knees, also knees. And the symptoms could be, all the urinary bladder problems like UTI, etc. Then lumbar 4, L4 is treated for the prostate gland and the muscles of the lower back and the sciatic nerve. This is a very important vertebrae which treats the, which is responsible for pain in the sciatic nerve, which we have already learned, when we are trying to treat for sciatica. And the possible symptoms obviously are sciatica and lumbago, which is lower back pain, difficult, painful, or too frequent urination also. That could also be, or a difficult, painful, or too frequent pains also could be the reason, and could be the symptoms. Then L5 is the lumbar 5 vertebrae, which is treated for lower legs, ankles, and feet. So generally for sciatica, we treat L4 and L5 because that covers the whole thing, the back problem, the sciatica nerve, and the pain going down to lower legs, ankles, or feet. And the possible symptoms could be poor circulation in the legs, swollen ankles, weak ankles and arches, cold feet, etc. After the lumbar vertebrae come the sacrum, and sacrum has to be treated for problems with hip bones and buttocks. Possible symptoms could be spinal curvatures, which could be responsible for a lot of posture issues and a lot of other, issues related to your legs. Then comes coccyx. Coccyx is to be treated for any problem with the rectum or anus parts of the body, and the possible symptoms could be, piles, hemorrhoids, pruritus, which is itching, or pain at the end of spine on sitting, which is very common for some people. So these are all the vertebrae that are related to different diseases that should be treated when you have that problem. Now, the most important thing what I had told you was this only, that we don't need to understand these or even try and figure out why these were chosen. Professor Park Ji-woo has done extensive research and study on this after his smile meditation, and he has arrived at these results, and we just have to follow these and just do the treatment according to them. It is, life has been very simple for us. Sujok is very simple for us only because of all the hard work that Professor Park Jae-woo did for us. In case of non-availability of these charts, in case you don't have these charts and you have to treat a person, basically treat the spinal cord, like I told you, according to reflection. The spinal cord point for face would be behind face, for stomach would be behind stomach, etc. Arms and fingers belong to the upper chest and legs belong to the lower abdomen. So you generally come to know that for face neck region, you have to treat the vertebrae between C1 to C7. Just look for a painful point between them. So, the area is already designated and it's a small area. You just have to find a painful point and you'll come to know exactly which vertebrae is affected due to that problem. For upper back region, including the stomach, you can treat anything between T1 to T12. For waist region, you can treat anything between L1 to L5, the lumbar vertebrae. For pelvic region, sacrum, and for hip region and below hips, as like legs and all, you can treat the coccyx. Now, so find the painful point in the spine according to whichever vertebrae is close to the organ to be treated. Just put a single seed on the most painful point and the fourth step is done. So it's a very simple step. The whole thing is like, the charts are so extensively given. Even if the charts are not there, it is very easy to find a painful point in that related, reflection part of the spine. Just try it and it's very, you will see. In fact, you can try this on yourself also, whichever problem you have. Just go to the reflection point on the vertebrae and look for a painful point, and you'll find a point which is extremely painful on the vertebrae, and you'll realize that is the point which is actually conveying the problem or the pain from the body to the brain. And by treating that, you are also solving your disease much faster. Thank you.